Girl.
And, you know, how we're going to meet them on the day of surgery, and just seeing that relief in their eyes, especially when they show up on surgery day and they see that same person they talked to in the pre-op clinic, they're like, oh, familiar.
They're comfortable and happy, and I'm happy. That is a success for me.
And sometimes the only thing that gets rid of that pushing pain is pushing.
Right.
Okay? Do you have any questions for me? Pour yourself some medicine. I want you to call Gail and tell her you're going to do that, okay? Because it can drop your blood pressure just like...
Goes on in an operating room. And so to say to them, well, if you've heard of certified nurse midwives or nurse practitioners, those are nurses that have gone for additional education and preparation to become an advanced practice nurse. And so I let them know that I'm like a nurse practitioner. And
you're managing their blood pressure, their heart rate, their breathing. You're basically keeping the patient alive and well. You're the only one taking care of the whole patient during a surgery.
Nurses have been doing anesthesia for many, many years. And in fact, there's some anecdotal and some doctors started developing nurses understanding that anesthesia is a specialty in and of itself, that you don't just...
Formal program to educate nurse anesthetists was started in 1909. Miss Agatha Hodgkins became the founding member of what became the American Association of Nurse Anesthetists Services, and we're well known for the excellent care and the lives they saved over there.
Nurse anesthetists have been giving anesthesia for 150 years. It was a nurse anesthetist who worked, she was taught how to give anesthesia, and the CRNA, Alice McGaw, gave the anesthesia. They set up a showcase.
All anesthetics were provided by nurse anesthetists, and they provide most of the anesthesia.
A nurse prepared and administered the anesthetic and watched you constantly for any telltale change with the same purpose: to ease the pain of war, to help save lives.
Any type of anesthesia in the back of a helicopter can be a challenge in of itself, especially when, you know, bullets are flying and, you know, they're doing tactical maneuvers. They can manage these patients, they can handle a critical trauma patient, because a lot of times these hospitals are in conjunction with these aircrafts. So once we come back, it's not uncommon that I would fly a patient in and then take them to the OR and do their anesthetic. You were that Swiss Army knife, you were that jack of all trades. You could do a number of different things.
Education, as time went by, of course, became more formal. And in 1954, that was the first time that the certification program started for nurse anesthetists.
Regional anesthesia is now part of the curriculum. The ability to work independently as advanced practice nurses everywhere have gained that. The ability to bill insurance companies.
Literally put them to sleep. To you, it's going to seem like no time. You're going to go to sleep, you're going to wake up, it's going to be done. Anything else?
I think so.
Okay, and I already asked you, are you warm enough?
I am warm enough.
Good. We'll probably fix that too. I'm going to put this up. Okay. So we have to...
Okay, super, good deal, so cool. Okay, and then the vitamin D, the Flomax, and then the Pro Air and whatnot for your asthma. And, yep, okay, great. And then not allergic to anything at all? Very good. So, we'll do the spinal block back there, and I'll also put some preservative-free morphine in that spinal to help you with pain relief afterwards. Usually that's about 24 hours or so with that, okay? And then just keep you as sedated as you want.
Any change in your heart history, any new chest pain or shortness of breath, anything like that?
Since I had the pacemaker put in.
Not since you had the pacemaker put in, okay. It's a little bit. That really comforts them.
So being able to build relationships quickly has really benefited me in my practice as a CRNA. Okay, Ms. McDonald, we're all ready to take you back, okay? Are you good? Mm-hmm. All right. I'm going to start to give you some sedation. All right, that's going to start to make you feel kind of drowsy. If you don't remember the trip into the operating room, that's completely normal, okay? We're going to take great care of you, okay? No worries. Thank you. All right. I'm going to fix your pillow. You start to just think good thoughts, okay? Under a general anesthetic, of course, the patient's rendered unconscious, but serving as their advocate that entire time is really the role of the CRNA, not what we do.
Tilt your chin up towards the ceiling, just a little bit. Perfect. Now take 3 or 4 real big, nice, deep breaths all the way in, all the way out.
Very tight on your left arm, okay? Just for a moment. Gonna check your blood pressure, all right? Everything's perfect. I know it's terribly uncomfortable just the first time. And then we're gonna give you a break, okay?
They taught us Sam Tide and do that routine every single time when you're getting ready in the morning and before every case so that you know you have everything ready to go.
And I think that that shows every time you watch a CRNA do anesthesia because they have to have everything set up. They have to have their little nest made in the operating room so that they feel they have everything right where they can get to it on a moment's notice.
It's a constant assessment. You know, in nursing school, it's all about the assessment. I feel that as a CRNA, we have to do it. It's an assessment of myself. It's an assessment of my equipment, of the patient, of the room equipment, the surgeon's beeper, the shoes that someone's wearing, whatever it is, it all has to be done.
CRNAs, nurse anesthetists, are there, and then we do rounds later on and post-op all of our patients to see if they had any concerns or any problems with the anesthesia.
I'm gonna give you a little bit more pain medicine.
Best anesthesia I have ever seen.
The signs and symptoms that I want you to tell me. Ringing in your ears, numbness around your mouth, or tingling around your mouth, okay? Funny taste in your mouth, like a metallic taste. I'm just gonna slip this right through here. Just lets me watch you a little bit closer, but if it tickles you or irritates you, you just let me know, okay? So I have a little bit of sleepy medicine going through there, but we'll just go real slow, okay? So here in a minute, he's gonna test you. You may feel pressure, but if you feel anything sharp, that's what we wanna know about, okay? Okay, or if you're uncomfortable at all, just let me know.
Okay, can you feel this?
No.
No?
He says no.
Feeling good, huh?
Externally, I think people think that anesthesia is, oh, I meet the person and then they put me to sleep, they wake me up. To get to know them a little bit.
Just putting a little airway in there for you. Just because you're getting good and sleepy. You're doing real good. You pretty comfortable? Okay. All right, you're going to doze right back off.
The assessment of the total person, not just the physical, but the emotional, the spiritual, all aspects of a person.
And so I went to anesthesia school and I loved it. It's like your own little mini ICU.
I think it's so exhilarating to be a part of the future nurse anesthetist training and educational process.
Is a doctorate in nurse anesthesia practice. I think that all of nursing is moving towards doctoral preparation and advanced practice nursing. That just is one more step in providing the highest level of care that we can to our patients.
What I'm going to do is I'm going to give you some medicine in this IV right here, and it won't hurt. There's no more needle plugs. I'm going to wipe this with alcohol. Something I've found over the years is being in one area long enough and working these hospitals long enough, the patients become almost like a family. And the patients will call me at home and say, hey, I'm having a surgery. Are you going to be there? I will go to people's homes and go see them.
Colorado are there for us. Gary is there for us, and we trust them and we like them being part of our community.
They can manage a patient, stabilize a patient, even if they're critical, using the whole spectrum of techniques, including intubation.
History that I need to be prepared for during that case, and I need to have a plan A, plan B, plan C for any event that.
I think having the holistic part of being a nurse is what makes nurse anesthesia such a special profession. When you
to meet the healthcare needs, and I think it's perfectly appropriate to expand that scope of practice as long as we have well-prepared, well-educated nurses who can provide that care safely and competently.
Some of the most difficult times that they have in a safe manner.
Having that type of experience and that connection with patients has really, brought it to the forefront.
We're basically their voice, their advocate the entire time they're asleep because they can't speak for themselves. So we're kind of their eyes and ears while the surgeon's performing.
It's rewarding both professionally and personally, and you can't ask for much more than that from a profession.
I think it's so comforting.